Now let us look at cervix and the pathologies of cervix. So far we have seen in the female genital tract, we saw the vulva, vagina. Now we are moving on to cervix, correct? Now in cervix, first let us see the parts of cervix. Okay, so here you have the cavity of cervix, you have the external os and the internal os. Fine. So when you are viewing in a per vaginal exam, the cervix will look something like this. The external os will look like this. Okay. Here you can see that there is ectocervix, endocervix, and here in the middle you have the squamo-columnar junction. It is squamous outside and columnar inside. You have the squamo-columnar junction. So let's move on to the diseases or pathologies of cervix. So you have cervicitis, that is inflammation. In tumors you have polyps, cervical polyps, then hyperplasia as usual. Then you have intraepithelial lesion, that is SIL, squamous intraepithelial lesion. It is also called as cervical intraepithelial neoplasia, CIN. Okay, this is important for the exam, so we will be looking at this. Under this they are using 4 terms: dysplasia, CIN, that is cervical intraepithelial neoplasia, carcinoma in situ, and SIL, that is squamous intraepithelial lesion. All of them are used synonymously, some slight difference which we'll have to look at. Then you have the invasive cervical cancer. Basically, cervical cancer is a very important, it's a very common condition, and hence they do a pap screening, pap smear they call it, and there's a Bethesda reporting protocol for these smears. Okay. So this has lowered the incidence of cervical cancer. In the cervical intraepithelial neoplasia or squamous intraepithelial lesion, there are 2 types. Okay. LSIL and HSIL. L means low grade squamous intraepithelial lesion. HSIL is high grade squamous intraepithelial lesion. CIN is cervical intraepithelial neoplasia. So these are the terms. There are only 2, low grade and high grade squamous intraepithelial lesion. So the human papilloma virus that are affecting type 6 and type 11 will cause low grade squamous intraepithelial lesion of cervix. Okay, in this the morphology will be chylocytic atypia, flat condyloma in the low grade one, and in CIN, that is cervical intraepithelial neoplasia, they are calling it as 1. Dysplasia is mild dysplasia. Okay. Coming to the high grade, in that the dysplasia will be moderate severe carcinoma in situ. Here they are calling it as neoplasia, cervical intraepithelial neoplasia 2 or 3. Here there is progressive cellular atypia, loss of maturation. Here the human papilloma virus which is causing this is the type 16 and type 18. They will cause the high grade squamous intraepithelial lesion. So these 2 points are important. Just look at this. LSIL corresponds to CIN1, that is cervical intraepithelial neoplasia 1. Okay, the low grade corresponds to this one. And what will you see? Flat condyloma having chylocytic atypia. It is usually related to human papilloma virus 6 and 11 infection. High grade squamous intraepithelial lesion, it corresponds to CIN2 and CIN3, and it has abnormal pleomorphic atypical squamous cells. Human papilloma virus 16 and 18 are implicated in the etiology. Okay. What is this chylocytic atypia? Flat condyloma. So here you are seeing the coilocytes. In this one, it's a low-grade squamous intraepithelial lesion. This is a high-grade squamous, squamous intraepithelial lesion of cervix. Here you will see scanty cytoplasm. Here there is abundant cytoplasm. In the first one, there is abundant cytoplasm. In the second one, there is scanty cytoplasm. In the second one, there is marked hyperchromatic nuclei. Okay. So let's just revise. This is the cervix structure, diseases. Intraepithelial neoplasia is important. In this, the types we have discussed. Let us read more about this again. Okay.